Hello, I'm Gurnaz, and this is my presentation about asthma and the respiratory system. The respiratory system includes organs responsible for the intake of oxygen and removal of carbon dioxide. The primary organs of the respiratory system are the lungs, whom undertake gas exchange in the body. Others include nose, pharynx, larynx, trachea, and bronchioles. The lungs also work with the circulatory system to carry oxygen-rich cells to the body's muscles, where the gas exchange occurs and waste products as well as carbon dioxide travels back to the lungs and out of the body. Fun fact, the lungs in the body float in water, and the right lung is larger than the left lung for humans specifically. However, there are diseases linked with the respiratory system. In this presentation, we will investigate asthma. Asthma is one of the most common medical conditions in people. Asthma is a condition in which the airways become narrow, inflamed, and swell to produce extra mucus, which makes it difficult to breathe. The symptoms of asthma include chest pain, difficulty breathing, cough, and wheezing. Asthma can last for years or even be lifelong in some cases. Respiratory problems occur when the bronchioles are blocked, thus resulting in less oxygen being able to reach the lungs. In asthma in particular, the bronchioles contract, however the airways are restricted as the lining expands and the fluids build up. The airway walls can become thicker if the asthma remains active. Asthma is a leading chronic disease in children and is common in boys more than girls. There are many triggers to asthma, such as allergies including dust mites, pollens, pets, and molds. Other triggers include smoking, viral infections, changes in weather, and cold air. Now, we will discuss how the respiratory system is affected by asthma. As we already know, asthma is one of the most common medical conditions in people. The symptoms of asthma include coughing, chest pain, and difficulty breathing. All these symptoms arise from problems in the respiratory system. As we know, the respiratory system plays a major role in gas exchange, as it intakes oxygen and outtakes carbon dioxide. The airways in the respiratory system split into two bronchioles. If the bronchioles are blocked, less oxygen reaches the lungs. When someone experiences an asthma attack, there are two stages. The first stage, the muscles surrounding airways contract, and the second stage is the inflammation stage. A great proportion of inflamed cells build up in the airways where the muscles contract. After this, the constriction is worsened by the release of substances by the cells and causes a build-up of fluid in the bronchioles. This results in symptoms such as difficulty breathing, chest pain, etc. There are many medical diagnoses and treatments for asthma. When you go to get a diagnosis for asthma, the doctor will do a physical exam and ask questions about your symptoms. Then there will be tests to measure the amount of air going in and out of your lungs. If the lung functions improve after the use of a bronchodilator, one is likely to have asthma. There are many other additional tests that take place after this, such as allergy testing, imaging tests, nitric oxide tests, etc. The asthma classifications range from mild intermittent, where one would expect to have mild symptoms up to 2 days a week and 2 nights a month, to severe persistent, where one would experience symptoms throughout the day and frequently at night. Treatment for asthma usually is 1. Getting to know the triggers, and in some common cases of asthma flare-up, one is recommended to use asthma pumps or relief inhalers. There are 3 types of medications for asthma, which are long-term, short-term, as well as allergy medications. Long-term control medications are taken daily and keep the asthma under control on a day-to-day basis. Quick relief medications, as mentioned in the name, are used for rapid, short-term symptom relief. These are taken during an asthma flare-up, or in some cases before exercise if a professional, which in this case is the doctor, recommends it. Allergy medications are used for when one's asthma is triggered by an allergy. In conclusion, asthma is one of the most medically treated conditions in people. It is a disease that occurs in the respiratory system of one's body. Symptoms of asthma include coughing, wheezing, and chest pains. It occurs when the muscles surrounding the airways contract. The constriction is then worsened by the release of substances by the cells and cause a buildup of fluid in the bronchioles. Diagnosis for asthma include a physical exam and the doctor asking several questions about your symptoms. Based on the diagnosis and further tests being taken, the doctor will prescribe medications.